Hi, my name is Cynthia Kamga and I am a pharmacy student. I will be presenting a case on a patient with pneumonia. The patient is Angelina Johnson. She's a 37-year-old African American female. She presents to the pharmacy complaining of fever, cough, fatigue for over 5 days. The patient's medical history shows that she has hypertension, asthma, and seasonal allergy. Her family history is non-pertinent. Her brother has ulcerative colitis, her mother has hypertension, diabetes type 2, and hypothyroidism. The social history of the patient: she's employed as a social worker, she's a non-smoker, she takes 4 glasses of wine per week, she denies illicit drugs. She lives at home with her husband and 2 young children, currently not pregnant and not breastfeeding. Medications. The patient's current medications are calcium carbonate 1000 milligram chewable tablet. She takes 1 tablet by mouth twice daily. She also takes atenolol 50 milligram oral tablet, 1 tablet by mouth daily. Her prenatal multivitamins, which she takes 1 tablet by mouth daily. Albuterol 180 microgram. She inhales 2 puffs by mouth every 6 hours as needed for wheezing. Brio Ellipta 100/25 microgram dry powder inhale. She inhales by mouth once daily. Flonase 50 microgram. She uses 1 spray in each nostril daily. The patient is currently allergic to latex, which causes her rashes, and penicillin, which causes diarrhea, which is actually not a true allergy but an intolerance. Immunization records. The patient is up to date with her childhood immunization. She received a flu vaccine in October this flu season. She received her COVID-19 Pfizer vaccine, all doses plus a booster within the past 6 months. Her review of system. The patient is alert and oriented ×3. She has chills, fatigue, fever, and malaise. Physical exam. Her skin has no rashes and erythema or pallor. Her recent general vitals shows that her blood pressure was 128/72 milligrams of mercury. Her highest temperature is 101 degrees Fahrenheit, and her respiratory rate is 83 respiration per minute. Her height is 70 inches, her weight is 150 pounds, and her BMI is 22.8 kilogram per meter square. Her laboratory data. Her labs shows that she has a BUN of 8 milligram per deciliter, a creatinine clearance of 0.9 milligram per deciliter, glucose of 89 milligram per deciliter, and white blood cell count of 13,000 cells per deciliter. The patient's creatinine clearance was calculated to be 92.1 milliliters per hour, and her BMI was calculated to be 22.8 kilograms per meter square. Diagnostic test. An X-ray was made and the result showed that the patient had right lower lung pneumonia with consolidation in the right lower zone of her lungs. The problem is stated to be non-severe community acquired pneumonia. Evidence of problem and rationale for the plan. The patient presents to the clinic with primary symptoms of fever, fatigue, cough, sputum production, shortness of breath, and malaise for past 5 days. Her X-ray reveals the presence of right lower lung pneumonia with consolidation in the right lower zone. Most of the patient's labs are within normal range except her BUN of 8, which is elevated. The patient currently has hypertension and asthma, which categorizes her under patients with comorbidities. Based on her CURB 65 analysis, this patient's score is less than 1 and her PSI is 51, which indicates the eligibility of outpatient treatment. Based on the type of pneumonia acquired by this patient, the different bugs which need to be treated are Streptococcus pneumonia, Haemophilus influenza, Staphylococcus aureus, and multi-drug resistant pathogens. Based on the above patient characteristics, the way she acquired the illness, her CURB65 and PCI score, the presence of comorbidities, and the fact that she can be treated at home falls under a certain criteria in the guideline. According to the 2019 ATS IDSA guideline, this patient can be treated with a combo, can be treated with either a combo or a monotherapy. She can be treated with a combo therapy of beta-lactam and a macrolide or beta-lactam and a doxycycline. Or the patient can be treated with a monotherapy of respiratory fluoroquinolone. The goal of the problem is to eradicate the disease. Based on everything said above, one of the most appropriate regimen for this patient will be a combo therapy of doxycycline and cefuroxime. Doxycycline should be 100 mg by mouth to be taken every 12 hours for 5 days, and cefuroxime 500 mg by mouth to be taken every 12 hours for 5 days. Safety, toxicity, and monitoring. It is important for the patient to be aware of some side effects of these medications, such as doxycycline with the side effects of photosensitivity, QT prolongation, tendon rupture, and a GI effect from cefuroxime. Also, the patient has to be cautious of the treatment window because prolonged use may result in bacterial superinfection. Efficacy and improvement monitoring. It is important to monitor the patient's respiratory rate to make sure it is improving, and to do a chest ray every month. Thank you.